Hello everyone, welcome back to my YouTube channel. So today we are going to be talking about causes of missed period without pregnancy. A lot of people miss their period without being pregnant because they will test, do scans, do blood and urine, and then they are not pregnant. And some people, they know because they did not involve in sexual intercourse, so they know they are not pregnant. So why then do I have a missed period? Why am I not seeing my period and I'm still very young? I'm still in the age that I should still be seeing my period. We have 12 points, 12 causes today that we are going over, so that you know that, okay, I'm not seeing my period, so this is why, maybe I should go to the hospital, or maybe I can do this and do that. So number one is stress affects many functions of our body, including our period. Stress increases our stress hormones and reduces the sex hormones and our ovulation. For some people, it stops the ovulation completely. So when you are stressed, most times, 60% of the time, you have irregular periods. You have ovulation that is fluctuating. This month you ovulate, next month you don't ovulate. Number two, we have short illness or long-term illness. Illness causes periods to be delayed. If you have a cold, you have catarrh, you have things like acute malaria and typhoid, chronic infections, and then taking antibiotics, all these things will delay your period or make you miss your period for that month or for even 2 months. Number three, we have change in schedule. Change in environment, change in diet, especially for women who do shift jobs. They find out that so many times their periods are longer, they are delayed a lot, or sometimes they even miss a period. Then number four, we have medications. Many medications affect period. Medications like antidepressants, blood pressure pills, and antibiotics. Missed or irregular periods are very common with people who take some of the birth control. Some birth control pills causes irregular periods or even missed period. There are some birth control pills that you take that you might not see a period for a whole year. Some for 3 months, some you even have mid-cycle bleedings. Number five, we have overweight. Overweight women have basic cholesterol compounds in their fat cells. This compound changes a type of weak estrogen called estrone. There's an estrogen in the body that is called estrone. It's not so strong. Overweight women carry extra fat cells in their body. These extra fat cells have a little effect on this weak estrogen, which have an effect on their glands that make this added estrogen cause bleeding or menstrual disorders. It's either they are not seeing period at all, or their periods are very, very irregular. They're even having period in 14 days, 19 days, which a normal cycle should be at least from 22 days. A woman that is overweight might see her period regularly and ovulate if she exercises, even if she's considered a little bit overweight, but at least if she's mobile, like moving her body, exercising, eating healthy, she will start to see regular periods and then she'll start to ovulate. Number six, we have being underweight. If a woman is underweight, she does not have enough body fat. So this type of women will not have regular periods. Underweight women can go for months without seeing their period. Their bleeding disorders are worse than people who are overweight. When you don't have enough fat, most of the times you don't have estrogen at all. Your body is not producing estrogen, so you will no longer ovulate, you no longer see your periods. So the right thing to do for them, if they eat well and they add their body weight, they do regular exercises, not the ones that will make them reduce weight, they start seeing their periods regularly and they start ovulating. Then number seven is miscalculation of your menstrual cycle. Some women do not know how to calculate their menstrual cycles, so they are always thinking that they have irregular periods. They don't know when it starts, they don't know when they are expecting it, some don't even know when it will end. So they're like, okay, I'm always having irregular periods. If you know when you ovulate, your period comes exactly 14 days after your ovulation day. Exactly 14 days after your ovulation day is the day you see your period. Anything other than that, your period is irregular. So if you want to know when you ovulate, when you see your period, start counting from that back to the 14th day. You know that, okay, this is when I ovulated. So you can do that for like 3 times, then you know your average cycle. If it correlates like 27, 28, 27, 28, and most 29, you know that your period is regular. Number 8, we have perimenopause. Perimenopause is the period of time when a woman is transitioning from your reproductive years to your non-reproductive years. Your period may be lighter, heavier, more frequently, like shorter periods, or less frequently, but just not normal. If you are not trying to conceive, you have to take preventive method very, very serious, because you are very much fertile and you will get pregnant and even have twins, triplets and quadruplets, because at this point your hormones are fluctuating, they are everywhere. So you can even release 3 eggs, 4 eggs, even 5 eggs during your perimenopause phase. But that period is still a period of period irregularities. You can go for 3 months without period, you can go for 2 periods in 1 month, and so on and so forth. Number 9, we have the menopause. The menopause is the phase when you reach a point in your life when you no longer ovulate or see your period. Menopause is not a medical condition and it's a must for every woman. If God blesses you and you reach that age, you must reach menopause. Sometimes people have symptoms that are outrageous because they've not been experiencing that before. So it becomes a thing of concern. You can seek medical intervention. You can seek the expertise of a fertility coach like myself, that we can help you to manage the symptoms, live a healthy lifestyle, and then enjoy your life in your advanced age. Sometimes surgical procedures are carried out to remove the womb completely, so this will cause you not to ever see your period or ovulate again, and it might cause a little bit of vaginal dryness. So eating healthy, being well lubricated is very good key during this period. Number 10, we have thyroid issues. Thyroid gland is located in our neck, at the back of our neck, and it helps to regulate our body's function by producing most of our hormones. Problem with your thyroid gland can cause irregular periods or missed periods. Illnesses like tuberculosis and diabetes can also cause missed or irregular periods. Number 11, we have vigorous exercises or excessive exercises. These exercises cause irregularities in your periods. Sometimes it causes you not to see your period for some time. Sometimes it causes you to see your period more often. Sometimes it causes you to see your period like once in 40 days, once in 50 days. For some people, they go 6 months without seeing period completely, or it might cause spotting or mid-cycle bleeding. This happens because when you are doing excessive exercises, your body needs to produce more energy, and when the body is producing so much energy to meet your vigorous exercise, your body ignores your other body functions like your period. So you might not see period, or the period may be fluctuating. It will be wondering, where should I go? What can I do? So it's good to check that, what type of exercise you are doing, especially for women who are trying to conceive. You have to keep it very, very minimal. Then our last point is pregnancy. Of course, any woman that is pregnant is expected not to see their period. I say expected because not all pregnant women go without period, go without bleeding. Let me not say period. Some bleed throughout their pregnancy, some have bleedings here and there, but a normal pregnancy is the one that you don't see your period for at least 9 to 10 months before your baby comes. So that is our 12 amazing points of why you can miss your period without being pregnant. But I say pregnancy, so pregnancy is part of it. Thank you all, and I'll see you in my next video. Bye.